Are pellets good for HRT? Let's talk about it. Pellets are hormones pressed into small cylinders that are injected under the skin. Pellets are similar to birth control implants in their delivery mechanism and are usually compounded. Hormone pellets are meant to last 3 to 5 months and are inserted during an office procedure into the fat of the buttocks. 20 years ago, I had a few patients interested in trying pellets for hormone replacement therapy, so I did a little research. Pellets use bioidentical hormones and are created in a compounding pharmacy, so I could individualize the dosing. Pellets weren't good at delivering progesterone, so we still had to use progesterone in a different form, usually transdermally. The issue I found with pellets is first, you need to have them injected every few months. Second, we cannot control the amount of hormones you're getting to absorb. Even though pellets are compounded to the prescriber's recommendations, some women's bodies suck the hormones out quickly, giving them super high levels initially, which may give them extreme side effects. But then the effects wear off and they barely get any hormones from the pellets. And so it lasts a long time in their system. We can't control it. So if it's not going to work for you, you're going to be stuck with those pellets until they dissolve, which can take 3 to 5 months. Third, and one of the biggest issues I have with pellets, is they only contain testosterone and estrogen, no progesterone. Progesterone is critical to protecting your tissues from the growth-promoting effects of estrogen to help prevent cancer. Progesterone also supports adrenal function, which is critical to maintaining healthy hormone levels throughout postmenopause. Testosterone in pellets tend to be high dose, assuming the patient will convert it into estradiol. Now, not all do and become androgen dominant. High levels of testosterone in women causes increase in facial and body hair, thinning of head hair, including male pattern baldness, weakness of ligaments and tendons leading to frequent joint injuries, mood disturbances with aggression and rage, elevated LDL cholesterol, and the risk of arteriosclerosis. Although I'm not a big fan of pellets as a form of hormone replacement therapy, it's an easy way for providers who don't know much about how to prescribe hormones because they send their patients' blood work to the pellet company and have the pellet company compound that particular hormone for the patient. The problem is that the blood work does not always reflect your hormone needs, determined by your symptoms, your risk factors, or your history. Your pituitary FSH and LH are more reflective of how much of each hormone you need at any particular point in the change. I don't go by your blood levels of estrogen, progesterone, and testosterone to determine the dose of hormones you're going to need, because your tissue levels and what's floating around in your blood are two different things. Since the dosages cannot be adjusted for at least 3 months, I do not use pellets in my patients. So what do I recommend? First, start with hypothalamic support. It's key to balancing all your hormones, your sex steroids, your adrenals, your thyroid, your pituitary, and insulin. Start with Genesis Gold, 4 grams for every 50 pounds of body weight. My menopausal patients who take Genesis Gold consistently detoxify their hormones safely and can use much less HRT. Second, micronized progesterone is crucial for perimenopause and helps balance estrogen in menopause. I prefer transdermal formulations, but because the absorption can be inconsistent, I recommend Genpro, the same transdermal formula I created with my trusted compounding pharmacist and have used in my patients for over 30 years. Genpro is safe and highly effective. Dosages range from 50 to 200 milligrams twice daily, applied to the inner thigh for best absorption. 3, estradiol in sublingual or transdermal form is usually what I recommended. Doses are adjusted for symptom control. Estradiol, available in pharmacies, is bioidentical and usually covered by insurance. Estradiol combined with estriol can be compounded by compounding pharmacists. Usually, estradiol dosages range from 0.5 to 2 milligrams daily. Estriol vaginal cream for genitourinary symptoms like incontinence and vaginal dryness can also be used. Vaginal estriol is highly effective and can be compounded by a compounding pharmacy. Doses are usually 1 to 2 milligrams nightly for 6 to 8 weeks until vaginal atrophy resolves. Then estriol vaginal cream is used 2 to 3 times weekly for maintenance. Deciding what type of HRT is best for you can be challenging. In my Menopause Action Plan book, I highlight all of your options to help you make the best decision. I'll see you in the next video.